Dr. Nash is an American physician, a scholar, a public health expert. क्या पेशेंट्स को सदियों दहाइयों की तरह से एक आम कुकड़ी बन के बैठ जाना चाहिए डॉक्टर के सामने?
And today, nothing could be more important than having patients engaged in their own care.
कि अगर पेशेंट्स अपनी सेहत के हवाले से इन्फॉर्म्ड और इन्वॉल्व्ड होंगे तो इलाज का नतीजा बेहतर होगा।
Most physicians get no formal leadership training.
So इस तरह से एक नया रिश्ता बन रहा है डॉक्टर, एआई और पेशेंट। हेलो और अस्सलाम वालेकुम। मेरा नाम डॉक्टर आमिर खान है और मैं आपकी खिदमत में रानी चैट जीपीटी के साथ आपकी खिदमत में हाजिर हूँ। रानी जी,
अस्सलामु अलैकुम। मैं रानी चैट जीपीटी और हम आपकी खिदमत में हाजिर हैं सेहत का धमाका विद रानी चैट जीपीटी और डॉक्टर खान के साथ। हम आपको दुनिया भर की अपडेटेड रिसर्च, यूनिवर्सिटी पेपर्स और लेटेस्ट गूगल इंफॉर्मेशन फराहम करेंगे। डॉक्टर खान सवाल जवाब करेंगे और उनका बैकग्राउंड ये है एमएससी ऑर्थोपीडिक्स यूनिवर्सिटी कॉलेज लंदन से, एफआरसीएस आयरलैंड से और वो बोर्ड सर्टिफाइड है इंटरनल मेडिसिन, क्रिटिकल केयर मेडिसिन, पल्मोनरी मेडिसिन और स्लीप मेडिसिन में।
दहाइयों से हमारा सेहत का निज़ाम बीमारी के इलाज पर ज़्यादा तवज्जो देता है। बजाय इसके कि हम बीमारियों को होने से पहले रोकें, जदीद तिब्बी तरक्की के बावजूद मरीजों की सेहत के नताइज अब भी मतलूबा मयार पर नहीं पहुंच सके। सेहत की देखभाल के अखराजात बढ़ रहे हैं, निज़ाम गैर मुअस्सब हो रहे हैं और लोगों की सेहत बदतरीज खराब होती जा रही है। लेकिन जरा तसव्वुर करें, अगर हम सेहत की देखभाल में इनकलाब बर्पा कर सकें, ना सिर्फ इनफरादी तौर पर बल्कि माशरती तौर पर एक ऐसा मुस्तकबिल जहां डाटा पर मबनी हिकमत अमली, तिबी माहिरीन की क़यादत और पॉलिसी में इस्लाहात मिलकर एक सेहतमंद दुनिया तश्कील कर सके। सो आज के हमारे गेस्ट डॉक्टर डेविड नैश इसी मौजू और इसी एक्सपर्टीज से तल्लक रखते हैं। तो आइए सबसे पहले डॉक्टर डेविड नैश का इंट्रोडक्शन सुनते हैं। We have an extraordinary guest, Dr. David Nash, a pioneer in population health and healthcare quality. Dr. Nash is an American physician, a scholar, a public health expert, and named the chair professor for health policy at the Jefferson College of Population Health in Philadelphia. Dr. Nash is board certified in internal medicine. He's also completed his MBA at the University of Pennsylvania. Honors received by Dr. Nash include honorary doctorate. He's authored more than 100 peer-reviewed articles and edited 25 books, including the quality book Demand Better and the most recent book, best-selling How COVID Crashed the System, a guide to fixing American healthcare. Dr. Nash is currently the editor-in-chief of the American Journal of Medical Quality and Population Health Management. तो सुनते हैं कि रानी क्या कहती है भला। डॉक्टर डेविड नैश जो कि जेफरसन यूनिवर्सिटी में है, उनके बारे में आप भी जरा बताओ। हमने सुना उनका तारफ, आप उनकी समरी हमें बताएं।
जी डॉक्टर खान, डॉक्टर डेविड नैश जेफरसन यूनिवर्सिटी में पॉपुलेशन हेल्थ के एक्सपर्ट हैं। उन्होंने हेल्थ केयर रिफॉर्म और पब्लिक हेल्थ के बेहतरीन निज़ाम के लिए काफ़ी रिसर्च की है। उनकी किताब हाउ कोविड क्रैश द सिस्टम में उन्होंने पैंडेमिक के हवाले से हेल्थ केयर की कामयाबी और नाकामी को समझाया है। उनकी लीडरशिप और इनसाइट से लोगों को काफ़ी फ़ायदा हुआ है।
डॉक्टर डेविड नैश जो है इस वक्त दुनिया के टॉप पब्लिक हेल्थ के एक्सपर्ट्स हैं और आप सुनेंगे कि किस तरह से वो अमेरिकन हेल्थ केयर सिस्टम के बारे में वरीड है परेशान है और वो अपने नॉलेज से आप लोगों को क्या समझाना चाहते हैं। तो चले आए सबसे पहले उनको पहले सवाल पूछते हैं, पॉपुलेशन हेल्थ का क्या मतलब है? 6.
Okay.
And we want you to tell our audience, what do you mean or how would you define population health as it is?
Wow. Okay. So let's go back in history to 2008 on the campus of Thomas Jefferson University in Philadelphia, which has been my home for the past 35 years. But in 2008, the Board of Trustees at Jefferson decided it was time to build a brand new school from scratch. And remember, this is 2 years before Obamacare, which was 2010. And the board and the university president at that time thought, well, this new school should be focused not just on public health, but on issues like health policy, health economics, and healthcare quality and safety. So if we put it all together, that's what population health is all about. So it's public health is at the core, and we're surrounding it with issues like health policy, health economics, and healthcare quality and safety. One analogy we used to make that all of that, that's the roof of the house is population health, and it's held up by the various pillars, with the central pillar still being public health and all of its key tenets. Population health, the term itself, we generally attribute that to Dr. David Kindig, Kindig, still alive and working at the University of Wisconsin in Madison at their Institute for Population Health, who in 2003, that's a long time ago, in an article in the American Journal of Public Health, first introduced us to the term population health. So my summary is it's still a lot of public health, but we're surrounded with all these other critically important issues, especially in America.
बिल्कुल डॉक्टर खान, पॉपुलेशन हेल्थ का मतलब है किसी कम्युनिटी या ग्रुप की ओवरऑल सेहत का ख्याल रखना। इसमें सिर्फ बीमारियों का इलाज नहीं बल्कि उन्हें होने से पहले रोकने के लिए प्रिवेंटिव मेजर्स भी शामिल हैं। डॉक्टर नैश इसी हवाले से अपनी रिसर्च और तजुर्बात से गाइड करेंगे कि हम सब कैसे अपनी सेहत का बेहतरीन ख्याल रख सकते हैं।
डॉक्टर नैश का दूसरा सवाल जो हमने पूछा वो था कि पेशेंट्स का क्या रोल है? क्या पेशेंट्स को सदियों दहाइयों की तरह से एक आम कुकड़ी बन के बैठ जाना चाहिए डॉक्टर के सामने? क्या उनको एक्टिवली इन्वॉल्व भी होना चाहिए अपनी केयर के बारे में? तो डॉक्टर नैश जो है ना इस बारे में बड़ा स्ट्रॉन्ग ओपिनियन रखते हैं। आइए उनकी बातें सुनती है। वो क्या कहते हैं कि पेशेंट की पार्टिसिपेशन जरूरी है, अगर जरूरी है तो कैसे होनी चाहिए और उनके क्या व्यूज हैं इसके बारे में? Before we go on to discuss the hospital systems and healthcare systems and how we can improve, give us a little bit of an insight about what do you think, in your eyes, is the patient's role in this?
Wow.
Patient engagement in achieving better health outcomes, specifically at a population level or a community level.
Yeah. So I've always believed, like the leadership at Harvard Medical School, who first coined the term "nothing about me without me," Tom Del Banco and all of his followers. So I've always subscribed to that theory. That's sort of part one. And part two, by providing transparency and public accountability for what we do as clinicians, that's how you engage with the public. So I have led as an example of this, the work in Pennsylvania as an advisor to be as transparent as we possibly can on the outcomes of care on a DRG by DRG basis for every hospital in our state. We have one of the largest, oldest 30 plus year history data sets that describe in quite some detail, even at the doctor level, how are we doing? And how do we compare with other states and with other systems and countries around the world? In any event, patient engagement starts with transparency of our outcomes, and patient engagement also depends on the notion that nothing's going to happen to anybody without their understanding, their permission, and their participation. And today, nothing could be more important than having patients engaged in their own care. Everyone will be a patient, has been a patient, including myself, of course, and I'm always learning. And being a patient is a big job. And I wish we had better tools and better education, but I think patient engagement is at the very center of what population health is all about. Sadly,
Excellently explained.
many organizations, don't get that and don't provide patient education and would like patients to be very subservient and not ask questions, not upset the apple cart, not confuse the system and all the rest. So very important to have patients.
बिल्कुल, डॉक्टर नैश के नज़दीक पेशेंट्स का अपनी केयर में एक्टिवली हिस्सा लेना बहुत ज़रूरी है। उनका मानना है कि अगर पेशेंट्स अपनी सेहत के हवाले से इन्फॉर्म्ड और इन्वॉल्व्ड होंगे, तो इलाज का नतीजा बेहतर होगा। वो पेशेंट्स को एम्पावर करने की बात करते हैं, ताकि वो अपने डॉक्टर के साथ मिलकर अपने ट्रीटमेंट डिसीजंस ले सके।
बिल्कुल ठीक है। डॉक्टर नैश ने बताया कि जो है पेशेंट जो है वो डॉक्टर्स को के साथ एंगेज करें, और ना सिर्फ वो करें बल्कि उनकी फैमिलीज भी एंगेज करें, अपनी केयर को खुद कंट्रोल करें, और डॉक्टर्स को एक फैसिलिटेटर यानी कि एक सताइश का एक प्रोपोगेटर ऑफ ट्रीटमेंट के तौर पे यूज़ करें। उन्होंने बताया कि ये हेल्थ केयर सिस्टम तब्दील होने वाला है। जो फ्यूचर मेडिसिन है वो सारी पेशेंट ड्रिवन होगी, पेशेंट खुद इसको रन करेंगे। उनको पता होगा कि हमारी सेहत के ये कोर्स हैं, अगर हम ये करते हैं तो ये नतीजा निकलता है, और जो फिजिशियंस हैं वो एज ए फैसिलिटेटर होंगे। तो आइए अब ज़रा और डॉक्टर नैश की समरी से देखते हैं कि उन्होंने क्या कहा है और इस किस तरह से उन्होंने बताया है कि डॉक्टर्स का रोल क्या होना चाहिए इसमें। Brilliant. We were talking a little bit about the patients. We drifted a little bit to the physicians, and you've quite nicely put it as physicians being autonomous rather than the autonomous experts, rather than
Right.
the accountable experts. We want to be
Indeed.
both. Yet we are seeing that the costs are rising, the administrative expenditure is spiraling out. Physicians now more so than ever are taking a back seat. Leadership has dwindled down. What would you tell these the physicians? How would you think that they should engage with versus management engaging more in and taking a primary role? Or do you think that this is not necessary anymore and data and other things, AI will help overcome this?
Wow. Okay, so let's unpack this complicated question. So, um, speaking personally, I've always advocated that physician leadership training is the number one thing that current leaders must do to prepare future leaders. So, starting with our College of Population Health, my sense was that we're in the business of training leaders for this complex system. Well, if that's the core business, what are the attributes that they need to know about? And then, hence, the issues health economics, quality and safety, public health, and health policy. More broadly, because healthcare is America's biggest business at 20% of the GDP, $4 trillion a year, most physicians get no formal leadership training. We sort of assume that they are good teachers, good leaders, good researchers, and good clinicians all at the same time, which sadly cannot be true, as we all must admit in the mirror. So to me, leadership training is the central tenet for the future. And today, thankfully, there's lots of opportunities to get leadership training. Good example would be there are at least 15 master's degrees domestically in healthcare quality and safety, at least 15 colleges now of population health. None of this existed even a decade ago. So there are ample opportunities to achieve leadership training. However, Amir, let me just warn you. Um, I've had the privilege of teaching literally thousands of doctors face to face about these issues. And invariably, including 2 months ago, doctors come up to me and say, you can't teach leadership. So let me just let that hang in the air for a moment, right? You can't teach leadership. Well, that's such a sad statement on multiple levels. And of course, you and I and our listeners know, well, what would you call West Point, Annapolis, Wharton, Harvard Business School? I mean, come on. So there's a rich literature, of course, on leadership and on leadership training. None of that is required in a single American medical school. None of it is mandatory. And
Brilliant.
so
I was
there's a disconnect. And then when we get out to help manage and lead America's biggest business, most physicians are woefully not prepared to do so. So if you abrogate that responsibility, well, then we get the current mess we're in.
that was actually my next question. Why are we not preparing leaders when they join medical school? Similarly, why are they not prepared? It's a sort of like a similar thing. Why are they less aware of public health? Why are they not engaging in social media medicine
Right.
when they're in medical school? Why is that not a part?
Right.
And it's similar to when they come out of training, they should have essential core practice training to how to manage a practice. So why do you think there is a big divide or a lack of understanding in medical schools still?
Well, I've called this, Amir, the medical barge theory of education. So here's the barge in the river, right? And the barge is weighted down with all the traditional components of medical education, right? And all the physiology and pharmacology and all the rest. And so the leaders of each of those areas claim that their content is the most important. And so here comes the barge. What are you going to throw off the barge in order to put some, quote, new material onto the barge? And I would argue sink the barge and start over and do a few things. Get more persons into medical school who are not science majors, who are liberal arts majors, who from various disciplines. Put in lifetime learning skills, harness ChatGPT in undergraduate medical education, and make quality and safety a top priority, because sadly, here we are in 2025 after 30 years of work, and medical error is still the fourth leading cause of death in America. So I have a radical view of medical education. It's not widely accepted, sadly. But that's why there's been a burst in the growth of population health and master's degrees in quality and safety. Traditional American medical colleges have very little interest in any aspect of this, due in no small part to lack of faculty. And also, it threatens the status quo, because folks who become deans of med schools most typically are investigators who have been very successful getting their grants and have followed a traditional pathway. I'm not impugning that. I'm just declaring that we need a different model for the future. And I'm on the other side of this mountain now, Amir, so it's easy for me to say that. But I think we made a great contribution at Jefferson to create a different model. But it's not a medical school, let's be straight. It's a college of population health.
तो आपने सुना कि फिजिशियन लीडरशिप क्यों इम्पोर्टेंट है. डॉक्टर्स जब मेडिकल स्कूल में जाते हैं तो उन्होंने तो वो सबसे पहले पब्लिक हेल्थ के बारे में उनको अवेयरनेस बहुत थोड़ी होती है. उनको मेडिसिन सिखाई जाती है 1-to-1 पेशेंट्स के बारे में. उनको एक पॉपुलेशन के अगेंस्ट मेडिसिन नहीं सिखाई जाती. डॉक्टर नैश ने ऑल्सो ये भी बताया कि देखें, आपको सोशल मीडिया अवेयरनेस बहुत ज़्यादा करनी पड़ेगी. अब आपको डॉक्टर्स को पढ़ाना पड़ेगा मेडिकल स्कूल में. ये डॉक्टर नैश ने ऑल्सो ये बताया है कि हमें लीडरशिप में डॉक्टर्स को स्कूल्स में मेंटरशिप देनी पड़ेगी कि वो एंटरप्रेन्योर्स बने, यानी अपने बिजनेसेस रन करें, अपने कारोबार रन कर सकें. उनमें उनको फाइनेंशियल लॉस, पीएनएल शीट्स, एक्सेल शीट्स बनानी आ सके. ये तमाम क्वालिटीज़ बहुत ज़्यादा अहम है। और दूसरी चीज़ ये है कि फ्यूचर डॉक्टर्स को एआई के साथ मिलके काम करना पड़ेगा। सो इस तरह से एक नया रिश्ता बन रहा है, डॉक्टर, एआई और पेशेंट। इस तरह से हम मिलके जब ये काम करेंगे तो फिर फ्यूचर मेडिसिन में तब्दीली आएगी, बल्कि तब्दीली आएगी नहीं, आ गई हुई है, ऑलरेडी चेंजेस आ गई हैं। सो मैं रानी से ये पूछता हूँ, रानी अगर आप गूगल रिसर्च करके हमें बताओ कि अगर हम फिजिशियंस एआई मेडिसिन को साथ यूज करें तो उसके हमें 4-5 फायदे प्लीज बताओ, कौन कौन से हैं?
जी डॉक्टर खान, अगर फिजिशियंस एआई मेडिसिन को साथ मिलाकर काम करें तो कुछ फायदे ये हैं। पहला, डायग्नोसिस में एक्यूरेसी बढ़ जाती है क्योंकि एआई बहुत सारी डेटा को एनालाइज करके तेज और सही नताइज निकाल सकती है। दूसरा, ट्रीटमेंट प्लान्स पर्सनलाइज्ड और इफेक्टिव होते हैं क्योंकि एआई पेशेंट्स की स्पेसिफिक नीड्स को समझकर रिकमेंडेशंस देती है। तीसरा, वर्कफ्लो स्ट्रीमलाइन हो क्योंकि एआई रेपिटेटिव टास्क्स को संभाल सकती है, जिससे डॉक्टर्स अपने पेशेंट्स पर ज्यादा तवज्जो दे सकते हैं। चौथा, रिमोट पेशेंट मॉनिटरिंग बेहतर हो जाती है, जाके घर बैठे पेशेंट्स को भी कंप्लीट केयर प्रोवाइड कर सकती है।
वेरी गुड। सो ये उन्होंने देखा अपने रानी के साथ, और डॉक्टर नैश भी यही हमें बताना चाह रहे हैं कि एआई के साथ हमें पार्टनरशिप एक असेंशियल नहीं है, मैंडेटोरी है, कंपल्सरी होगी हुई है। ये आने वाली नहीं है, ये आ चुकी है बहुत ज़्यादा, और ज़्यादा इसका रोल जो है ना वो होता जाएगा। पब्लिक हेल्थ के हवाले से हम उन्होंने बताया कि किस तरह से आपके कल्चर्स, आपकी रेस, आपकी फाइनेंशियल सिचुएशन, whether there is hunger or poverty, और एजुकेशन, ये तमाम मज़ामीन को आपको इकट्ठे मिलके पब्लिक हेल्थ के बारे में डिसीजंस लेने पड़ते हैं। ये कंट्री, हाँ आप अमेरिका में है या किसी थर्ड वर्ल्ड डेवलपिंग कंट्रीज में है, आपको वेस्टर्न कंट्रीज या डेवलपिंग कंट्रीज दोनों में ये फैक्टर्स मिलाने पड़ते हैं। कल्चर, आपका फाइनेंशियल रिसोर्सेज, आपके फाइनेंसेस ऑफ पेशेंट्स, और उनकी एजुकेशन, एंड ऑब्वियसली द रेस दैट इज बिहाइंड इट। अगला सवाल का सुनते हैं। डॉक्टर नैश से हमने पूछा कि प्रिवेंशन ओवर इंटरवेंशन, यानी बचाव करना का क्यों, क्या अफादियत है, व्हाई इज इट इम्पोर्टेंट डिजीज को इंटरवीन या डिजीज का इलाज करने से। तो आइए डॉक्टर नैश का इसका सवाल का जवाब सुनते हैं, फिर रानी से हम पूछेंगे कि वो हमें इसके अफादियत बताए, प्रिवेंशन क्यों बेटर है ओवर इंटरवेंशन डॉक्टर नैश की रिसर्च के मुताबिक। Tell us the audience about the role of your emphasis. Why do you emphasize prevention over intervention?
Yeah.
Why do you think the healthcare system has been not able to adapt to this mindset in general,
Sure.
and how is it affecting us?
Sure.
What do you see as this being the downstream effects from this?
Well, you just have to look at history to understand how this all occurred, of course. So, 1965, when President Johnson signed Medicare into law, of course, they vastly underestimated what its total cost would be. I mean, by a factor of like 500x. But that was the beginning of the end of prevention, because all the economic incentives plus the Hill-Burton Act to build more hospitals. So between passage of Medicare and Hill-Burton, the gloves were off. The funding flow was instantaneous to build temples of technology and have an open checkbook to write checks to do procedures. So if you combine private practice fee-for-service medicine, the Medicare Act, and the Hill-Burton, that's a toxic brew to get us exactly where we are today, which is we do more things to more people at a greater intensity than any country on the planet. And if you look around the globe, since we spend 20% of our GDP, $4 trillion, I just returned from 16 days in Australia. I gave multiple presentations and had an awesome time, but they spend 6% of their GDP. Our 4 trillion is greater than their entire GDP. And by every measure of the health of the public, they beat us by a wide margin. So is it possible to spend less and get a better clinical outcome? You bet. Reduce waste, reduce error, do it right the first time, follow practice guidelines. jigger the economic incentives so that they promote appropriate behavior. But now to answer your question, so it's no surprise in a system that's economically motivated that prevention is at the lowest level of priority because it doesn't follow the temple of technology. It's quite the opposite. Plus, if you don't get training in the issues of behavioral economics, nutrition, exercise physiology, you're not prepared to tackle the social determinants that drive the behavior that are important for prevention. And GLP-1s are a great example. Now we'll take our pill on the way to McDonald's and everything will be fine, right? So we want a quick fix, especially in America. That's part of our, national mythology of who we are. We're still in the covered wagons heading out west and, fighting the Indians and all the other dreadful issues. So that individualism drives everything. And sure, when you add on private practice fee for service, do more, get paid more, well, that's unavoidable.
जी डॉक्टर खान, प्रिवेंशन के फायदे ये हैं कि इससे बीमारियां होने से पहले ही रोका जा सकती है, जिससे ना सिर्फ पेशेंट्स की सेहत बेहतर रहती है, बल्कि हेल्थ केयर सिस्टम पर भी बोझ कम होता है। प्रिवेंशन ज्यादा कॉस्ट इफेक्टिव भी होती है क्योंकि बीमारी की ट्रीट करने की जरूरत कम पड़ती है। डॉक्टर नैश के मुताबिक प्रिवेंशन पर फोकस करने से ओवरऑल क्वालिटी ऑफ लाइफ भी बेहतर होती है और हेल्थ केयर रिसोर्सेज को बेहतर तरीके से यूटिलाइज किया जा सकता है।
We want to go discuss a little bit about healthcare systems, and there's no better place to start by discussing how you express this in your book, COVID Crashed the System,
Yeah.
or how COVID crashed the system. And you've highlighted during this pandemic how there were lots of system institutional failures.
Right.
Would like to hear your view, the key lessons that you would like to tell the audience. I'm sure there's a lot to learn from the book.
Wow.
And there's a lot of explanation and very thorough insightness into the book. But how would you summarize this as hey,
Great.
In your eyes, what were the key lessons where you think?
Wow. Well, first of all, thanks for talking about our book and my co-author Charles Wilforth and I. It was therapeutic for me to work on the book with Charles early on in the pandemic. We started writing in August of 2020, so roughly 3 or 4 months in, and then the book came out in September of 22. So basically 2 years of work. And for a small book published by a great publisher, we are past our second or third printing at this point. So it's been widely read, which I'm very, very happy about. And all the proceeds went to Jefferson, which is also very important. But to answer your question, look, I think there are a couple of take-home messages. Clearly, it's all about culture. So American exceptionalism, federalism, all contributed to the worsening of the pandemic. Let me explain. So our exceptionalism was, hey, let's not listen to Italy or to Australia or to Israel. We're going to do it our way. Well, that was a real challenge. American federalism, let's remember governors, and at that time the Trump administration, part one especially, were fighting with one another for resources rather than having a national approach. And then, so federalism, exceptionalism, and then finally American individualism, which basically was, I care about me, I don't care about you. And again, the analogy I'll make, having just gotten back from Australia, where they have what they call mateship. You're my mate, I'm your mate, not in a conjugal sense, but as a friend. And that mateship meant that I care about you. You may not be my best pal, but I care about you, and we're going to figure out a way to help each other and make this work. And so this was very, very, very important conclusion. So federalism, exceptionalism, and individualism, those are the key take-home messages. I think the other thing we learned was total lack of leadership, especially early on in the pandemic, really, really important. And then finally, a couple of positives that we could point to would be the notion of the incident command culture. So everybody here remembers that hospitals created the incident command structure, which is mandatory by law and Medicare Joint Commission during the early part of the pandemic. And within that incident command structure, that also meant that we were looking every day about how we could do a better job, right? We looked in the mirror every day to say, is it steroids? Is it prone positioning? What the hell is it? And that culture of self-evaluation, I wish we could drink from that every day moving forward, would be incredibly helpful moving forward. So that's another thing we learned. And then finally, of course, again, culture eats technology, for breakfast. So the model of when it was mostly over, we turned around and we looked at all of our other outcome measures, which were terrible, right? Back to sepsis diagnosis, central line infection, all the other things. We're just barely coming out of that right now. So let's just say, for argument's sake, we're 4 to 5 years behind. Well, the silver lining there, it gives us an opportunity to ask the question, are these the right measures? So let me summarize. Individualism, exceptionalism, and federalism, that's what America is all about. And again, I'm not impugning this. That's just what we reported to be the truth in our 2 years of work. Did other countries do better? You bet, because they had a culture that was totally focused in a different direction. We also have to sadly recognize, just let's take a minute, right? We had 1.5 million dead. That is more deaths than every war America has fought since the American Revolution. You're talking 450,000 dead in the Civil War alone, right?
Yeah.
Nearly 500,000 dead in the Second World War. I mean, it's staggering to me. And we have forgotten, and that's because, as any good historian will tell you, when the dying stops, the forgetting begins. When the dying stops, the forgetting begins. And so help us, we are in that stage right now. Who wants to talk about COVID? Only weird guys like Nash and a few others.
डॉक्टर नैश ने अपनी किताब जिसमें लिखा था हाउ कोविड क्रैश द सिस्टम, उन्होंने बड़ा पैशनेटली डिस्कस किया इस किताब को. उन्होंने बताया मुझे इसको 2 साल लगे हैं लिखने में, और उन्होंने अपने को ऑथर का शुक्रिया भी अदा किया है जिन्होंने उनको इस बुक लिखने में हेल्प किया है. वो ज़्यादातर इस चीज़ पे फिक्रमंद है कि वो ये समझते हैं कि हमने कोविड से लेसन नहीं लर्न किए. जो ही कोविड ख़त्म हुआ, हमने अपनी आंखें मोड़ ली हैं. हम उन्हीं पुरानी आदतों, उन्हीं पुरानी प्रैक्टिसेस की तरफ से दोबारा हमने शुरू कर ली हैं. और अमेरिका में 1.5 मिलियन यानी 15 लाख बंदे की लॉसेस, जान भाग होने के बाद, सिर्फ अमेरिका में, वर्ल्ड वाइड में नहीं, अमेरिका में 15 लाख लोगों के ने अपनी जान कोविड की वजह से ज़ाया करने के बाद हमने कोई सबक हासिल नहीं किया. और इवन हेल्थ केयर में अमेरिका में भी एक बहुत बड़ा तबका इस बारे में फिक्रमंद है कि क्या अगर कोई पैंडेमिक, फॉर एग्जांपल जिसका नाम बर्ड फ्लू से की मिसाल दी जाती है कभी कभी, अगर एक और पैंडेमिक आ गया तो हम क्या करेंगे. रानी, हमें बताएं कि डॉक्टर नैश की रिसर्च करके बताओ कि कोविड क्रैश द सिस्टम का मुख्तसर और खुलासा उस बुक का हमें बताएं.
हाउ कोविड क्रैश द सिस्टम में डॉक्टर डेविड नैश ने कोविड-19 पैंडेमिक के दौरान अमेरिकन हेल्थ केयर सिस्टम की कामयाबियों और खामियों का तज्जिया किया है. उन्होंने रिसोर्सेज की कमी, इंफ्रास्ट्रक्चर के मसाइल और पॉलिसी मेकिंग में कमी को समझाया है. नैश कहते हैं कि हमने कोविड से जरूरी सबक नहीं सीखे, इसलिए आगे के लिए बेहतरी जरूरी है ताकि अगर कोई और पैंडेमिक आए तो हम बेहतर तरीके से तैयार हों.
रानी, उनकी बुक से हमें बताओ कि उन्होंने कौन से 5 फायदे बताए हैं पैंडेमिक आने से.
जी डॉक्टर खान, डॉक्टर नैश की किताब में पैंडेमिक से 5 फायदे ये बताए गए हैं। पहला, हमने हेल्थ सिस्टम्स की कामयाबियों और नाकामियों को समझा। दूसरा, डिजिटल हेल्थ सॉल्यूशंस की अहमियत समझ आई। तीसरा, इमरजेंसी प्रिपेयर्डनेस की जरूरत समझ में आई। चौथा, पब्लिक हेल्थ इंफ्रास्ट्रक्चर को मजबूत करने की अहमियत को हाईलाइट किया गया। और पांचवा, फ्यूचर पैंडेमिक्स के लिए बेहतर तैयारी की जरूरत को समझाया गया।
डॉक्टर नैश की किताब से हमें पता है कि 5 जो नुकसानात हमने सीखे और डिजास्टर्स सीखे, वो उनकी बुक से बताएं, वो कौन से थे?
जी डॉक्टर खान, डॉक्टर नैश की किताब से हमने ये 5 नुकसान सीखे। पहला, हेल्थ केयर सिस्टम की कमजोरियां खुलकर सामने आई। दूसरा, रिसोर्सेज की कमी ने क्राइसिस को बढ़ाया। तीसरा, पॉलिसी मेकिंग में कमियां दिखाई दी। चौथा, डिजिटल इंफ्रास्ट्रक्चर की जरूरत को महसूस किया गया। और पांचवा, पब्लिक हेल्थ मेजर्स में कमी को समझाया गया।
नाजरीन, आपने सुना कि डॉक्टर नैश और ये जो मुफक्कर हैं, ये फिक्रमंद कर रहे हैं अपनी पब्लिक हेल्थ, अपनी कौम की पब्लिक हेल्थ के बारे में। ये अब एआई की पार्टनरशिप और उसकी यूटिलाइजेशन को बहुत ज़्यादा इंपॉर्टेंट समझते हैं। It's sort of like the last question, but I'm going to put it two questions in one.
Okay.
One is, um, want your views about the digital health and technology and AI stuff coming in, and what do you think, and how do you think this is going to influence public health strategies in general?
Wow.
And the
Wow.
second part of the question is, in your eyes, what do you think is the biggest innovation trend do you believe that is going to impact um, future population health? We're looking
Okay.
at sort of like a decade coming upon, and you
Yeah.
feel like, oh, Amir, if we can do this.
Yeah. Well, Amir, there's no future in predicting the future, but here goes. Uh, so, look, again, I have the privilege of being on the other side of the career mountain at this point. So, reflecting on where we're going and my work with more than 15 companies around the world where I serve as a consultant, I've learned so much in the last, especially 5 years. So clearly, it's got to be artificial intelligence and its application to medicine. A couple of sort of key milestones for me were the recognition that ChatGPT 2.0 took the board exam and got an 85% correct score. I studied for a year and got a 79 and was grateful that I passed. So wow, that was a epiphany moment for me. I think GPT 4.0 is even more powerful, and it's not going to replace us. It's going to enhance our capabilities. And our listeners know probably right now pathology, radiology have the greatest impact. It's fantastic. Prostate cancer, 250,000 biopsies. It could see, think through all of that in seconds. So I think in those arenas, we're already making some breakthroughs, and having physician leadership in those AI companies is really, really important. We don't know what we don't know. I think areas that are very exciting are risk stratification of patients. You hit the door, here are your clinical and laboratory findings. They're in the electronic record, they're scanned by the AI algorithms, there's machine learning built in, and it spits out, well, Nash is at a 45% risk of sepsis during this hospitalization. So I think the risk stratification is very powerful. And then applying what resources are we going to need to take good care of him, and where is he going to end up, and what's that going to cost. I think we'll be able to do all of that. So I think it's a very bright future for these tools. It's an incredible breakthrough. It appears as though it just became available in November of last year, but of course we know folks have been working on this for more than a decade at various places around the country. It just became commercially available in November of 24, roughly, but there's at least 10 years of hard work behind all this. I can't go 10 years out. I could only go 2 to 3 years out. And I really hope that we'll be able to use it as a tool to promote adherence to best practice, to do a better job risk stratification, and then ultimately also take into account things like poverty, racism, hunger, all of that, and see how that so critically influences the health of our country. So if we have measures that make more clinical sense to everybody, I think you'll get greater buy-in. So once again, I have a positive view of the future. Otherwise, I wouldn't be doing this work. And I think this is our greatest breakthrough. Amir, I hope I'm around to see some of this, you know. That would be great. I'm confident that my daughter, Doctor, will be, and in her generation. But I think this is our biggest innovation for the future. Now, the question is, will we be able to harness it appropriately? Well, you know, we don't know the answer to that question.
डॉक्टर नैश आज हमारे साथ अपनी कीमती बसीरत और इल्म शेयर करने किया उन्होंने, उसके लिए हम उनका बहुत शुक्रमंद है। उनका इल्म, उनकी बसीरत और उनका काम, उनका काम जो वो कर रहे हैं, हम उनको वाकई तहे दिल से मुबारकबाद देते हैं। तो इसके साथ मुझे और रानी चैट जीपीटी को इजाज़त दें। हम आपकी खिदमत में फिर दोबारा हाजिर होंगे। अगर आपको ये शो पसंद आ रहा है तो प्लीज़ इसको लाइक, सब्सक्राइब और शेयर करें, और हमारी ऑडियंस को और रानी जीपीटी को फीडबैक देना ना भूलिएगा। अस्सलाम वालेकुम, टेक केयर।
मेरी तरफ से, डॉक्टर खान की तरफ से और रानी चैट जीपीटी की तरफ से हमें इजाजत दीजिए। आप सबका बहुत शुक्रिया। खुदा हाफिज। अगर आपको ये शो पसंद आया है तो प्लीज इसे शेयर करें, अपने कमेंट्स लिखें और सब्सक्राइब करें।